significant public health problem across the globe because of increasing the prevalence of myopia, and it has become epidemic in certain regions of the globe, particularly in East Asia and Southeast Asia. And it is an important cause of visual impairment, especially in affecting the school-going children. In East Asia, prevalence around 80 to 90% young adults have myopia, and in India, if we talk about India, and according to NIM study, it was 13.1% in young school-going children, and about in more than 15 years, it has become 20%. So there's a significant increase in myopia in last decade in rural children also. Previous studies showed that it is only in urban children that's more, but now in rural also the incidence is increasing. And this is because of the availability of the internet and more screen time and more indoor time, less outdoor activity. Or because of this, now the incidence is increasing in the rural children also. And this meta-analysis by Holden et al. Predicted that by 2050, around 50% of world population will become myope, and out of these, 10% are high myope, which is associated with visual impairing complications like the retinal detachment, macular degeneration, glaucoma, and the peripheral degenerations. And this is a meta-analysis from India also, which also concluded that myopia is an emerging public health problem in both urban and rural school-going children, and which requires an urgent effort. Looking at all this, we conducted a study to find out the influence of time spent outdoors on myopia progression by following these children over the period of 2 years longitudinally. So it was a hospital-based study done over a period of 2 years at tertiary care center. So we included all children of 6 to 14 years presenting with a decreased vision with myopia less than 0.5 or worse, and those giving consent. But we excluded children who had refractive other than myopia, had a family history of myopia because we wanted to exclude genetic factors, and patients with other anterior posterior segment disorders were excluded. So total 580 children were enrolled. All children underwent cycloplegic refraction. We prescribed them glasses. And children were followed every 6 months for 18 months, and every visit cycloplegic refraction was done to know the refractive error. Then we recorded the time spent outdoor activity. So we asked the parents to record the activity of their child at home and school during weekdays, weekends, separately on a chart provided to them at home. And they were asked to bring this record every time when they come for follow-up every 6 months. And these activities were defined as playing in ground during break in the school or at home, or riding bicycle, running, even sitting in daylight was considered as an outdoor activity. So we calculated average time spent outdoor activity per day by dividing the activity in 7 days by total hours outdoor activity in week by 7. And participants were divided into various age groups. And then we did a statistical analysis of our data collected of 495 participants. And this is the table which shows the profile of all the participants, their myopia and their outdoor activity at all 4 visits. So first we record this chart shows the baseline data at the baseline visit, their myopia in spherical equivalent in diopters and time spent outdoors in hours per day. Then at first visit, second visit, third visit, what was status of the spherical equivalent at every visit, and how much the time they spend outdoor at every visit in next 1.5 years. So coming to the results showed there was an association between the spherical equivalent and time spent outdoors hours in these children. And this was determined by the repeated measure correlation. And what we found that it was statistically significant correlation was found between these two. It was negative, means those who have more outdoor activity has a less myopia progression regarding association. So this is the chart which shows the inter-individual association between myopia and outdoor activity during these 3 follow-up visits. And this dashed line represents a negative relationship between the myopia and the outdoor activity. Those who had a good outdoor activity has a less progression compared to those who have a less outdoor activity and were indoor most of the times. Then we tried to find out the magnitude of relationship also between the outdoor activity and the, their myopia. So what we found that each of our increase in outdoor activity per day had a negative effect on the spherical equivalent by 0.6 diopters. And this again had a negative magnitude, means again those children who have more spending outdoor had a less myopia progression. So these study findings are closely in line with Sydney myopia study, which suggested a protective role of time spending outdoors on myopia in children of less than 12 years. Another study done in India, NIM study, they also showed the prevalence of myopia was less in children who are playing outdoor more than 2 hours per day. So what is the mechanism? Why the children has less myopia, those who are more outdoor compared to indoors? So it is said that it is due to the release of dopamine from the retina in response to daylight exposure, and this enables the elongation of the growth of the eyeball. So the strength of study that there are minimal recall biases because we gave a chart to the parents to record the activity actually and bring the calendar. Where other studies when we compare, they all had based on recall. They had questionnaire based. They had to ask the question to parents how much is the outdoor activity, but ours was documented outdoor activity. And this follow-up study, so we could establish a relationship, causal association between the outdoor time spent outdoor and progression of myopia. Sample size is large, but limitation that is an institutional study, so it cannot be extrapolated to the general population. So to conclude, increasing our time spent outdoor activity at home and school is a simple strategy to prevent the onset and progression of myopia in these children. And this is the first hospital-based study which we have done in Indian school children in a tertiary care in India, and we have published this in AIOCMTC also. So lifestyle modification required to prevent this epidemic of myopia. We should encourage the children to play outside instead of spending more time on screen and in the indoors. Thank you so much. These are my references.
Thank you very much. Dr. Jashi, you have a question?
Wonderful presentation, Dr. Saroj. What are the recommendations that you would like to suggest to the schools regarding this?
Yes, there's something which is very important.
Because we know the recommendations for the parents, but what are the recommendations for the school or the educational institutes?
School, they have to increase their break periods and encourage the children to go outside to play in daytime. And there are randomized control trials done in China where they compare the two schools. When one school, they added 1 extra hour of outdoor break period, and they followed from the 3 years, then found the onset and progression was less in those children.
Yeah,
so the school, we have to encourage that they should give more break period to the school children, and they should be encouraged to play outside than to sit inside.
That's what I wanted to bring out actually, that like we used to have 1 week, 1 sports day.
Yes.
1 day was dedicated to sports, but now what is required for the kids especially, you have at least 2 hours of outdoor activities, because for parents sometimes it becomes difficult to regulate.
Yes.
But as teachers, when they are forced to go outside for 2 hours, I think that is more beneficial, and that is going to help more than academics.
And to decrease the screen time also, because now when young children are looking at mobile 6 months, 1 year, 2 years, so screen time has to be decreased and distance has to be more.
Yes.
These are the reasons to decrease the progression.
Thank you.
Thank you. A very relevant study, and not too many cohorts are there like this. So it's a very good study. IAP has already come up with recommendation regarding screen usage. Maybe we also need to do something, because advocacy is happening from them for ocular health. But we are only not giving up these absolute guidelines. So I think we also need to be having more such studies where we can have such recommendations.
This is the first study we have done, a follow-up study.
So I think we need many more studies like that.
Thank you so much.
Thank you.
Nice presentation. This study was already done in other countries like Singapore, where they have increased.
In India, sir, all studies are cross-sectional studies.
Anything you have learned from that study and incorporated in this one?
Yes, sir, because their follow-up studies are there from Singapore also, where they followed for 3 years. And their randomized control trials are also. So we have done an Indian population, it was not done. So we decided to do in our children also, and it's a hospital-based. Now we are doing in the population-based. Which is ICMR funded project we got, and now we are doing in the schools we are going, and we are doing study in schools also based on this study.
Thank you very much.